good day. I am Jezreel de Rosa, a student nurse at University of Cebu, Banilad from BSN 1N. And I have here my patient, which is my younger brother. And I would like to inform you the nursing procedures that I'll be presenting now, which are the bed bath, offering a bedpan, oral care, and lastly, the bed shampoo. Let me tell you first what is bed bath. Bed bath means bathing a patient who is confined to bed and unable to bath himself or herself, and its purpose is to clean one's body. And of course, as we all know, that baths are used to treat various diseases. So let's start.
We need first to wash our hands. This is to prevent spreading of possible microorganisms. Next step is to gather equipment for a demonstration. This is to save time and be prepared for the procedure.
After preparing the equipment, we'll be offering a oral care to our patient.
For the first step, wash hands to control the transmission of infectious agents. And for our second step, gather equipment for demonstration to save time in collecting the equipment while doing the demonstration. Then for our third step, provide privacy to prevent embarrassment and discomfort to our patient. And for the self-help client, flossing and brushing. And for the fourth step, place client in a Fowler's position to give patients comfort and safety. Then for the fifth step, wash hands, apply gloves to protect yourself and your patient to unnecessary outcomes. And then for the sixth step, arrange articles within client's reach to keep your client safety when doing self-care. Then after that, assist client flossing and brushing as necessary. Position mirror, emesis basin, and water with straw near the client and a towel across the chest to our patient to ensure that no liquid or debris remains. And assist client with rinsing their mouth to ensure that the patient rinse to remove particles and the toothpaste. And then reposition client, raise side rails, and place call button within reach of our patient to ensure that the patient is safe and comfortable. And then after that, self-care client denture care. This is for the 10th step. Assist client to a high Fowler's position to help them switch position. Then wash hands and apply gloves to avoid getting microorganism comes from the patient and vice versa. And for our 12th step, assist client with denture removal with tissue. Grasp tap denture with a thumb, forefinger, and pull downward to help the patient in removing the denture to prevent it from falling out and stumbling.
And for our 13th step, place in denture cup to keep denture from drying out and losing its shape and keep it moist. Then for our 14th step, place thumbs on the gums and release the bottom denture. Grasp denture with thumb and forefinger and pull upward to easily get the denture. Then for our 15th step, place in denture cup to keep the denture from drying out and losing its shape and keep it moist.
And for our 16th step, apply toothpaste to toothbrush and brush dentures either with cool water in a emesis basin or under running water in the sink. Pad sink with towel to protect dentures in case they are dropped, like this. Rinse thoroughly to remove debris easily and excess toothpaste. Then, assist client with rinsing mouth and placing dentures to prevent patient's dentures from falling. Then, reposition client with side rails up and call button within the reach of our patient to ensure safety of our patients. Rinse thoroughly to remove debris easily and excess toothpaste. Then, assist client with rinsing mouth and placing dentures to prevent patient's dentures from falling. Then, reposition client with side rails up and call button within the reach of our patient to ensure safety of our patients. And for our 20th step, position client as conditions allows, high Fowler's, semi-Fowler's, or lateral position, head turned toward side to increase the safety of our patient. Then for our 21st step, place a towel across client chest or under face and mouth if head is turned to one side to avoid spilling on the patient's clothing. Then, after that, moisten toothbrush. Apply small amount of toothpaste and brush teeth and gums to loosen accumulated debris in the mouth and to prevent oral disease and infections. And after that, grasp the dental floss in both hands or use a floss holder and floss between all teeth, holding floss against tooth while moving floss up and down side of the teeth to ensure plaque which causes tartar formation. After that, assist the client in rinsing the mouth to provide clients comfort in rinsing their mouths. Then, reapply toothpaste and brush the teeth and gums using friction in a vertical or circular motion on inner and outer surfaces of the teeth. Hold brush at 45 degrees angle against teeth and brush from sulcus to crowns of the teeth. Then on biting surfaces, move brush back and forth in short strokes. All surfaces of teeth should be brushed from every angle to ensure that all angles of our teeth are cleaned thoroughly. Using a wet toothbrush ensures that the toothpaste dissolves and is applied more effectively to our teeth. Then assist the client in rinsing and drying their mouth to avoid building up of bacteria. After that, apply lip moisturizer if appropriate to keep lips moisturized and prevent having scoliosis. Then, reposition client and raise side rails and place cough button within reach to promote safety to the patients. And for the third step, assess the client's preferences about bathing. This is for the client's convenience. Is the temperature of the room okay with you, sir?
Yes, nurse.
Okay, sir, thank you. And for the next step, explain the procedure to the client to keep client informed and encourage cooperation. So, good day, sir. I am your nurse for today, Nurse Jezreel. So, please state your family name and your first name, sir.
Rosa Luis Terence.
Okay, sir. So, your birth date?
January 6, 2000.
Okay, so the procedure that I'll be doing for today, sir, is the bed bath. Okay, sir? So, for me to be able to accomplish this procedure, sir, I'll be needing your cooperation for this matter. Okay, sir? And along the procedure, I'll be asking questions. And you may answer it properly, okay, sir?
Yes, nurse.
Okay, sir. Thank you. For the fifth step, prepare environment. Close doors, windows, adjust temperature, provide time for elimination needs, and provide privacy. To prepare the environment for the client's comfort and privacy in order to maintain confidentiality. Wash hands. Apply gloves as needed. Gloves should be changed when emptying water basin. This is to prevent spreading of microorganisms, and of course, we need to use gloves to protect ourselves from infectious diseases. Then, lower side rails on the side close to you. Position client in comfortable position close to the side near you to have effective use of proper mechanics in cleaning the patient. Next, if bath blankets are available, place bath blankets over top sheet. Remove top sheet from under bath blanket. Remove client's gown. Bath blanket should be folded to expose only the area being cleaned at a time. Top sheets or towels may also be for bath blankets. To prevent patient being soiled or moist during bath, we need to use blanket to provide comfort and privacy to the patient. Please hold, sir. Here, sir. and put this in the laundry basket. So now, we'll be offering a urinal to our patient. Do you want to urinate, sir?
No, nurse. I'm fine.
Okay, are you sure, sir?
Yes, nurse.
Okay. Offering a urinal is most commonly used in healthcare for patients who can't or don't want to get out of bed, or patients that are unable to stand and go to the restroom. Urinals allow patients with cognition and arm movement to urinate without assistance of staff. So for the first step, it is necessary to prepare the materials, which are the bath towels, powder, soap dish, bath blanket, clean linen, deodorant, soap, washcloths, clean gown, lotion, wash basin, and of course our disposable gloves. And for our second step, do hand hygiene or hand washing and put on gloves after drying. This is to prevent transmission of microorganisms, and wear gloves for us to be always safe during the procedure. And for the third step, provide privacy. It is to prevent embarrassment and discomfort to our patient. And for our fourth step, explain to the patient about the procedure to keep the patient be informed about the procedure that we'll be going to demonstrate and to encourage the patient to have a cooperation. Next, determine if the patient needs help in urinating. This is to evaluate patient's independence and to provide privacy. Then, we will assist the patient in a comfortable position to ensure patient's comfort in our care. And if the patient needs assistance, hold the urinal for them. Position the urinal properly and gently. If assisting a female, help the patient spread her legs and cover for privacy. If you are assisting a male, put the penis in the opening at the top of the urinal and cover for privacy. This is to prevent spillage and ensure that the patient's body is in the proper position to prevent urination problems. Next, when the patient is done urinating, carefully remove the urinal to avoid being exposed to urine for an extended period of time. That will lead to infection. After the patient uses the urinal, do perineal care. Use a damp cloth or wet wipes. For women, be sure to wipe the area from front to back. Put on new gloves if soiled to ensure that after urinating, the private areas are cleaned properly. Cross-contamination can be avoided by changing gloves. Next is we dry the area between the patient's legs to provide comfort and prevent growing of microorganisms in the wet areas. Then analyze and measure the patient's urine output to monitor and to ensure that the patient intake proper fluids. After that, we need to empty the urinal into the toilet to avoid contamination and being exposed for a long time. Rinse and wash the urinal using a disinfectant diluted with water. Dry the urinal or let it air dry to ensure that all microorganisms have been removed from the urinal and make it safe and clean for future users. Next is take off your gloves and dispose it properly to avoid contamination and spreading of microorganisms. Next step, after doing the offering a urinal procedure, continue with the bed bath. And for our next step, fill wash basin 2/3 full. Permit client to test temperature of water with hand. Water should be changed when soap film develops or water becomes soiled. Let the patient check the temperature of the water for their convenience and to provide comfort. And it relaxes the muscles and to avoid unnecessary chilling. So we have 2/3 of water here in a basin. So can you check the temperature, sir, if it's suit to you, sir? It's okay. It's okay, sir. Thank you, sir. And for our next step, wet the washcloth and wring it out. This is to prevent unnecessary wet of patient. And for the next step, make a bath mitten with a washcloth. To make a mitten, grasp the edge of the washcloth with a thumb, fold a third over the palm of the hand, wrap remainder of the cloth around the hand across the palm, grasping the second edge under the thumb. Fold the extended end of the washcloth under the thumb and tuck under the palm surface of the cloth, like this. This is to retain water and heat better than loosely held washcloth. It is to keep edges from bursting against patient and to prevent from splashing. Then wash the face. Ask the client about the preference for using soap on the face. Use a separate corner of the washcloth for each eye, wiping from inner to outer canthus. Wash neck and ears, rinse, and pat dry. Many clients may want to shave at this time. Provide assistance with shaving as needed. This is to reduce infection transmission, bathing eye from inner and outer, and it prevents secretion from bathing. Do you want your mustache to be shaved after sir?
No, nurse.
Okay, sir. So let's start. For the 13th step, wash arms, forearms, and hands. Wash forearms and arms using long, firm strokes in the direction of distal to proximal. Arms may need assistance.
Are you okay, sir? Are you okay, sir? Okay. Let's now wash your arms, sir. You may now wash the arm of your patient from distal to proximal. Assist the arm of your patient.
And you may wash the axillaria. Try. You want me to put deodorant on you, sir? Yeah. Okay. Immerse client's hand into basin of water. Allow hand to soak about 3 to 5 minutes. After 5 minutes, wash hands, interdigit area, fingers, and fingernails. This is to lower surface tension and facilitates removal of debris and bacteria and to stimulate circulation. And let's do it on the other side. And after 3 to 5 minutes, let's wash it. Interlace fingers. Fingertips. Fingernails and fingers. Next, place a towel across the client's abdomen. Fold bath blanket down to umbilicus. This will help you reach the inside part of the body of your client. Next, wash abdomen using long and firm strokes. Replace bath blanket over chest and abdomen and remove the used towel. Make sure to cover chest and abdomen area between washing, rinsing, and drying to prevent chilling. This is to avoid unnecessary exposure to client's body parts, especially if your patient is a female. We need to use towels to cover from any spillage, then rinse and pat it dry to properly clean. Then wash legs and feet. Expose leg farthest from you by folding bath blanket to the midline. Bend the leg at the knee. Grasp the heel. Elevate the leg from the bed and cover bed with bath towel. Place wash basin and towel. Place client's foot into the wash basin. Allow foot to soak while washing the leg with long firm stroke in the direction of distal to proximal. and toes. Rinse and pat it dry. Perform the same procedure with the other leg and foot. We need to use towels to prevent exposure to the client and to prevent soiling. And for our next step, wash back. Assist client into prone or side-lying position facing away from you. Face at the dito, sir, ha? Thank you, sir. Wash the back and buttocks using long, firm strokes. Rinse and pat it dry.
And wash the buttocks.
This is to position the patient to exposure of the area. This is to clean the dirt in the patient's back part of the body and put lotion if necessary. You want me to put lotion on your back, sir?
No, nurse.
Okay, sir. And also give a back rub to the patient. I'll massage you, sir, ha? Replace the bath blanket and remove the used towel. Then the perineal care. Assist client to supine position. Perform perineal care. This is to give clean the perineal care of the patient to prevent the spreading of bacteria. What you are gonna do here, sir, you should clean your private part, sir, okay? To remove the bacteria in there, sir.
You may dry it, sir. Then, after that, do the aftercare to ensure proper cleanliness of the room. And put this in the proper receptacle.
Then lastly, it's a must to wash our hands after the procedure to prevent ourselves from spreading off microorganisms. So that's it for our bed bath procedure. We must remember to always follow proper hygiene to achieve a better care to our patients. Goodbye!